All right. Assalamualaikum warahmatullahi taala wabarakatuh. And good morning to all the participants for breakfast at UMHealth. So this week we are going to have a special coverage for World Kidney Day 2022, which will happen tomorrow, right, Albert? Tomorrow. Yes. So this year's theme for World Kidney Day is Bridge the Knowledge Gap to Better Kidney Care. So we are from the Nephrology unit of UMMC, and we are going to bring you some quizzes, some fun, and some explanation to the answers. Okay. So before that, so let me introduce to you about this year's theme. This chronic kidney disease is common and harmful. 1 out of 7, if it's in Malaysia, adult people have it. And if left untreated, it can be deadly. While early detection allows for disease care and management to help prevent morbidity and mortality and improve cost effectiveness and sustainability, kidney disease-related mortality continues to increase yearly and is projected to be the 5th leading cause of death by 2040. A persistent and ongoing CKD knowledge gap exists, and one that is demonstrable at all levels of healthcare. So this knowledge gap is stifling the fight against kidney disease and increasing the inherent associated mortality. So for this year, what we are going to do during World Kidney Day breakfast at UMHealth is that we are going to allow the participants to enter the quiz if you have read the description in the poster. So we are waiting for more participants to come because, you know, we want as many people as we can to participate. The quiz is easy. It's not difficult. Prepared by these panels, Dr. Albert, Dr. Lee, and Dr. Maisarah, which they will be discussing the answers. If you are not satisfied with the answers later, then you can ask them. The level of the question is not hard. It's not at the nephrology kind of a training. It will be probably at the medical student MO kind of a level. Bit of a general knowledge and a bit of a detail a little bit. We are going to use Kahoot. So if you are familiar with Kahoot, then this is the time for you to practice your skill. But for those who are unfamiliar with Kahoot, basically Kahoot is an online game where people from their own site or using their mobile or using their laptop, they can answer the question in Kahoot. So we'll give you, so there are three ways to enter the Kahoot. Number one is basically you can type in the internet browser kahoot.it, and then immediately they ask you to put the game number. So I'll give you the game number later. Or you can download from the App Store. So some people find that more quicker and you have a higher chance to win, but I don't think you have time to do that. And then the third one is that there will be a QR code later that you can scan, and then you can do that. All right, so in the meantime, I will share the video. I'll share the screen so that you all can see how to get into the Kahoot quiz. So there will be a number. So yeah, so that number, you enter it into your kahoot.it or in your app, and then we wait for the quiz to start. Important point, those who cannot join includes those panels who are on board, all the nephrologists, and then the trainee nephrologists. If you are a medical officer, nurses, medical students, you can enter. If you think you can Google the answer, you can Google the answer. There's no limit to that, but I think the time will not allow you to do that. What else? There will be a prize, top 3, as agreed by our head of unit, Prof. Lim Sukun. Okay, so we have Gayatri as a Cassius Clay. So it is important, the name that you put up, basically something that you have to contact me later on, because when we show you who's the winner, then I'll give you my phone number. You contact me so that I can pass on and take your picture as a winner of a Kahoot quiz today. Okay. All right, so we have a couple of people. So DP Alicia, Siti Pong, Z Sakina, Ain Cassis, Clay, Gayatri, SA, FA, Sakina. So we are going to start our quiz, probably another 4 minutes, so 8:10. So ask your friends to join. Top 3 will get a prize. So in the meantime, World Kidney Day is a yearly event. So last year we also have World Kidney Day and the breakfast at UMHealth Symposium. So last year we talked about transplant and experience of the patient, as well as briefing by Dr. Maisarah. I think the year before that we have something about CKD. So almost every year. So thanks to the Faculty of Medicine for allowing us to, they actually have a special slot every March for us to do this. So far we have 15 participants. 14. Don't need. Make sure your connection is good, because Kahoot really depends on the connection. The faster you answer, the higher marks you get. So we will get, even if you get all the questions right, the fastest answer will give you a higher mark. So we will get number 1, number 2, and number 3. This Kahoot quiz, don't worry about the limitation. We can have participants up until 100, 200, even more than 200 participants. So don't worry about it. So in the meantime, I'll introduce you. We have another 3 minutes to wait for the participants. How come the number is dwindling down? 12 only. From 15 to 12. We need more. So in the meantime, I'll introduce you to 3 panelists or 3 judges who has provided the questions. Thank you very much. So Associate Professor Dr. Maisarah is a key person of transplant in UMMC. So she's not around yet. So she'll join us later. So we have Dr. Albert Hing, who's okay. Albert, can you introduce yourself and your area of specialty?
Hi everyone, I'm Albert. In the renal unit, and I am currently in charge of the peritoneal dialysis unit in the renal division. So I've been here since 2016, and I do UMSC as well. Thank you.
Dr. Lee, you may introduce yourself and your specialty.
Okay. Hello everyone. I'm Dr. Yee Wan. I also joined Nephrology since 2018. Yeah, and I'm interested to sub or learn more about glomerulonephritis diseases.
All right, thank you. So Dr. Lee is our newest nephrologist. So we have Associate Professor Dr. Maisarah. So Dr. Maisarah, can you introduce yourself? Unmute mic.
Yep. Yeah. Okay. Hello, hi. Assalamualaikum and good morning. I'm Maisarah. I'm from Nephrology. I'm one of the consultant in Nephrology unit. And my special interest is in transplant, in kidney transplantation. I think that's about it. Yep.
All right. Okay. So it's 8:10. We have 13 participants. It's okay. I know it's very early in the morning, and usually participants will enter later. But the early birds get the worm. So the rules again. We have roughly about 15 questions. The first 3 or 4, I'll explain to you. The first 3 or 4 is just a training. So don't worry. about the training part, so you just answer as best as you can. So after the quiz session, we'll have the winner, but after that we also will discuss the questions and answers with all these three panelists. And then after that, hopefully we still have time. If you have any questions to ask us about kidney disease or anything related to kidney disease, then you can ask us in the question and answer box. So without further, okay, it's coming. I think people are just joining in. Yeah, so those who put the name HK, because we are going to give gifts or prizes for those winners. So just make sure you identify yourself later on when you contacted me, okay? $19. Pin for the game. Okay, Albert. 3465275. So again, those who just joined us, we are going to have a Kahoot quiz. There will be prizes for the top three. You can either join three ways. Enter in the browser kahoot.it, and then they ask you for the game pin. The game pin is 3465275. Or you can download the Kahoot app from the App Store or Play Store if you don't have it already. Or you can scan the QR code from the thing that you can see. Okay, so the number is rising, so don't worry. There are 15 questions, about 20 to 30 seconds each question. Most of the questions are one best answer, but not at the level of masters, kind of a one best answer. So there will be like exception, things like that. So that will make easy. And those who are driving, I don't think you're allowed to participate because it can be dangerous.
Hafiz, you got tell them got the trick question or not?
Trick question? I don't think so. I think most of the question that you submitted are all kind of a straightforward. So yeah, I don't think it's there are trick questions. And plus, I think we're learning from making questions as well in UM, right? So if we do a trick question, our aim is not to trick the students. Our aim is basically to get them to show what they know about certain topic. All right, I think 8:15. I extend the time to 8:15. All right. Oh. Again, thank you very much for those who are attending. As we can say, early birds catch the worm. Okay, so we have not everybody who are online participating. I assume that you don't have any free hands for now. But anyway, thank you for those who are participating and attending online. We really appreciate your support for the World Kidney Day 2022. Okay, I think it's 8:15, so we are going to move on to the quiz. So you can still join. It's just, not sure whether you can beat other people or not if you join halfway through. Okay, so thank you very much. So we're going to start our quiz now. So the first few questions is just a kind of a test question. So we'll see. Okay. Bismillah. . All right, the first one is a poll. Tell me about yourself. There's no mark yet for this, okay? So you're answering very fast, so it's very good. All right, so basically 5 consultant, 12 medical officers, 1 house officer. Thank you very much for coming, and 9 medical students. So how confident you are in answering kidney related questions? Again, this has no marks yet. Okay, good. So still remember your nephrons. Hopefully that may help you in this quiz. What is the theme for World Kidney Day 2022? So there's no marks yet here. But after this question, we'll start the real quiz. All right, so bridge the knowledge gap to better kidney care. So living well with kidney disease was last year. Prevention to detection and equitable access to care was the year before. And kidney health for everyone, everywhere was the year before. So this year is bridge the knowledge gap to better kidney care. So are you ready for the quiz? Yeah. So let's start. All right. So everybody 0 starts. So let's start from now. What is the latest CKD prevalence in Malaysia? So you have about 9%, 13%, 15%, and 17%. All right, thank you very much. So 11 of you got it right. So it's about 15%. We'll discuss this later after we finish all the quizzes. So ready for the next one? Oh, okay, so we have TT. Next question. Miss Ali, 70 years old, with serum creatinine 150, eGFR of 40 mils per minute. What CKD stage is he in? So creatinine 150, GFR 40. All right, so CKD stage 3B. Again, we're going to discuss this and how is this impacting the patient. Okay, next question. Oh, interesting. Okay, it's still early. 2 questions. We have 15 questions altogether, so you still can overcome this. Which of these groups does not need screening for CKD? Metabolic syndrome, 70 years old, SLE, on aspirin. Okay, so majority got it right. If you're on aspirin, it's not a requirement for you to get screening for CKD. Okay, very good. Next question, Mr. Hisham has CKD, told to reduce dietary protein. Which food has the highest protein content? 1 plate of fried cauliflower, 1 plate of Wagyu steak, 1 bowl of fruit, 1 glass of black coffee, or 1 cup of black coffee, I guess. Easy. Okay, so majority got it right. Biggest content of protein, steak. Okay, still holding the leaderboard. Mr. Ali again has diabetes and early CKD. Which new medication was shown to reduce CKD progression? So I think this medicine is like the the medicine of the year for the past 2 years or 3 years. I think many medical subspecialty likes it. Yeah, so SGLT2 inhibitor, which I think all the medical students by now should know. All right, question 9 out of 18. Mr. Ali again needs CTPA and has CKD. What agent is used to reduce contrast nephropathy? All right, saline hydration. 9. Okay, so that's interesting. So I think Dr. Lee will discuss about this later on. All right, next. PT is the highest climber. Mr. Ali again, 45, due to diabetes. Which of the following is the best therapy for him? Hemodialysis, peritoneal dialysis, kidney transplant, and traditional healer. Of course, autonomy is important, but we also can give our opinion. All right, okay, so these will be touched by Dr. Albert later, kidney transplant. In Malaysia, what is the most common cause of kidney failure for patients needing dialysis? Is it obesity, diabetes, hypertension, or glomerulonephritis? That's true, majority got it right, diabetes mellitus. And I think in Singapore and Mexico as well, nearly 70% end-stage kidney disease are due to diabetes. Okay, another 6 questions roughly. Which of the following is not a complication of long-term dialysis? Not a complication, okay? So mineral bone disease, cardiovascular disease, anemia, dialysate toxicity. Okay, so dialysate toxicity, not a common one. Okay, 1, 2, 3 is maintaining the spot. Find an incorrect statement. So there are 30 seconds here regarding renal replacement. Incorrect, okay? Which one is not correct? All right, yes, so it's the other way around. Many people are on hemodialysis and minimum on peritoneal dialysis. All right, what is the most common type of donor for kidney transplant in Malaysia? So we're entering transplant now. So a mouthful words for each of the answer. Which one is most common in Malaysia? All right, yeah, so living related transplant. Still maintaining, good. In Malaysia, this person can donate without needing the approval from the government. So the hospital can decide straight away that, you know, I don't need a permission from the government to donate. This person can straight away give donation. All right, yeah, spouse, you don't need to go through the committee to decide whether they allow it or not. What is the leading cause of death in early post-transplant period for recipient? Is it a cardiovascular event, infection-related, malignancy, transplant rejection? So it's a cardiovascular event, yes. Rejection is important, but it doesn't lead to death usually. Ooh, who's climbing there? Okay, good. Next, last two questions. Pregnancy. Which of following transplant medication needed to be stopped, which is dangerous for people who are pregnant? Cyclosporin, prednisolone, mycophenolate, and tacrolimus. Maybe may need a little bit of a knowledge here compared to other questions. Yeah, it's mycophenolate mofetil. Ooh, okay. So, and the last question, next one, is not one best answer. So basically you have to choose more than one. And you can get double marks as well for that. So still chance to win. Okay, so don't lose hope. So last question of the day. Long-term complication for the donor. Is it hypertension, malignancy, stroke, renal failure? All right. Okay. So yeah. So a bit of a risk of hypertension, a bit of a renal failure towards the end. All right. So let's see who's the winner. FA. Okay. So all these three NAR. Is it NT? Wow. Okay. Congratulations to the winners. Because I don't know who you are, so I'll give you later if you could contact me so that I can give the prizes to all three of you. Okay, with that, thank you very much. And now I invite all the three panelists to be with us and discuss the question. So we have roughly about 20 minutes. So we have about 15 questions, okay? 1 minute per question. So we'll start off with Dr. Lee. Dr. Lee, you have slides to share with us.
Okay, so good morning, everyone. So I'll be discussing the answers to the first 6 questions. So the first question, what is the latest CKD prevalence in Malaysia? So this is based on the latest study by Saminathan and Dr. Hui et al., which was published in 2020. And they found that the latest prevalence of CKD in Malaysia is 15.48%. This is increased from 2012. In 2012, also they did a similar study. At that time was about 9%. So the answer is 15.5% lah.
Dr. Lee, can I butt in and ask questions, right? So basically for diabetes, we know from NHMS is about 18%, CKD is 15%. There's not too many different, but seems like people know a lot about diabetes than the CKD. What do you think about that?
Yeah, I think because the promotion or for the public to be aware, and also albuminuria is so that we can identify the risk of the patient and and manage them more appropriately lah. So for example, a patient, the patient just now, he has a GFR of 40 but no albuminuria, so he is at this orange box compared to the similar patient, but if he have a heavy albuminuria, he will be at the red box, which shows he have a higher risk for CKD progression, and we need to be more aggressive to control the proteinuria and other risk factors to retard his CKD progression. Okay, so this is simplified. If just based on GFR, it will be stage 3B lah. Our patient was GFR 40. Okay. The next question, the third question is, which group does not need screening for CKD? So metabolic syndrome, those with diabetic hypertension, obesity, all we need lah, age more than 65, and also those with SLE. So patients on aspirin is not indicated to screen for CKD. This is based on latest CP in the Ministry of Health guideline in 2018. And these are the recommendations for the group of patients that need to be screened for CKD. Age more than 65, obesity, metabolic syndrome, gout, patients with SLE, and also patients on certain group of medications. Okay, next question. Mr. Hisham was told to reduce dietary protein because he has CKD. So which of these food has the highest protein content? I think logically is a steak lah. But I did some research, so I found that one serving of cauliflower has about 2.1 grams of protein. One serving of a steak, 26 grams of protein. One serving of fruits, depending on what fruits, about 4 to 6 grams of protein. And one serving of a black coffee is only 0.3 grams of protein. Okay, okay, next question. Mr. Ali has diabetes and early CKD. What new medication is shown to reduce CKD progression in diabetic patient? This one, I think everyone's got it right. The answer is, of course, SGLT2. I think endocrinologists, cardiologists, nephrologists, everyone is discussing about SGLT2 in these past few years. So in terms of management of CKD and diabetic, the use of SGLT2 is well proven in this Credence trial that shows the primary outcome of doubling of serum creatinine, end-stage kidney disease, and death due to cardiovascular or kidney disease has been reduced by up to 30%. Okay, and this has been included in the latest KDIGO 2020 guideline for management of patients with diabetic and CKD, whereby they have included SGLT2 inhibitors in their plan of management. Okay, and the last question for me was about contrast-induced nephropathy. A patient with CKD was planned for CTPA, and this was the option. We get a lot of referrals from other teams about this. Okay, and this is a study. It's the PRESERVE trial, which was published in 2018, and their conclusion shows that between sodium bicarb, sodium chloride, and acetylcysteine and placebo, there's actually no difference for the prevention of contrast-induced AKI. Yeah, so I think that's
fine. Thank you very much, Dr. Lee. Yes. So from the PRESERVE trial, I think UMMC participating in it. I think Prof. Wan was one of the investigators as well. And then you can see in the last question as well, a lot of people are still answering N-acetylcysteine as one of the way to preserve or to prevent contrast-induced nephropathy. So what's your practice, Dr. Lee? Are you still giving NAC?
No.
You don't give anymore. Okay.
Yeah, so usually I just give with hydration.
All right, okay. And then can I check? I think we have a question from Mr. Haris, who's our vascular surgeon, very close to us. He said, why all Mr. Ali? There's no other Mr. We actually have other things, like we have Mr. Hisham as well initially. And to be honest, because Kahoot only give you like 120 character, Haris, so that's why I have to use the shortest name that I can think of. So that's why I use Ali. Okay. Anyway. All right, so let's move on to Dr. Albert. So your dialysis or renal-related renal replacement therapy questions. So for you, Dr. Albert.
All right, my questions is on dialysis. So this is the first question. Which of the following therapy we are talking about? Mostly renal replacement therapy. So in Malaysia, we actually have 4. So traditional healer is not in the part of the renal replacement therapy. So usually it's hemodialysis, peritoneal dialysis for the, these are quite well known, and we have kidney transplant, and the last one is actually conservative, mainly reserved for those who are very elderly with a lot of comorbidities, where we think the lifespan is and the quality of life is actually limited, and those are the patients that we actually consider conservative. So that's why I put Mr. Ali. Mr. Ali, the name came from Hafiz, so it came from me, but the age actually came from me. So I put it at 45 because I don't want an elderly patient, so that you all won't choose the option of either traditional healer or think of conservative. And I'm actually surprised that I think when I was looking at the Kahoot results, majority of the participants actually choose hemodialysis. So that shows that we are still very far away of the awareness of which renal replacement therapy is actually the best for our patients. So let's look at this data from 2016 from our Malaysian Dialysis and Transplant Registry. If you look at the data, this is PD and this is HD. So if you see PD, this is the dialysis interval. If you look at 5 years, which is 60 months, PD is only left with 44% and HD is left with 53%. So when we counsel patients, if you start on dialysis, in 5 years, out of 10 patients, there's 5 patients alive. So that is how bad is the statistics is. And if you look at 10 years, 120 months, you are left with 24% for PD and 28% for HD. So it means out of 10 patients, there's only 2 to 3 patients alive at the end of 10 years. And that's how bad the statistics are 10 to 20 years. Despite the advancement in the HD and all the techniques, newer machines we have, the statistics have not actually changed much. So that's how bad it is. But if you look at transplant, this is again from our Malaysian data, 2016. If you look at survival for renal transplant, at 5 years, it's actually 90%. So at 10 years, it's actually 70%. So at the end of 10 years, out of 10, you still have 7 alive. And this is actually a very good, relatively compared to HDPD, this is actually a very good data. So for a young patient who actually has not much contraindication for renal transplant, this should be the replacement therapy of choice for the patient. Every time if we are an end-stage patient, we should always include HD, PD, and also transplant in the counseling. So that's the answer, kidney transplant.
All right, thank you.
Next question. So next question, in Malaysia, what is the most common cause of kidney failure? So I think most of the participants got the answer correct, and I'm sure you all know, because like a lot of patients you see in Malaysia has diabetes, and that our 2000 national registry. So if you look at data, you notice an alarming rise in the proportion of our dialysis patients who is diabetic. So you see over the 1969 down, it was actually very little, but at the end of 2018, we has about almost our end-stage patients, almost 70% is have kidney failure due to diabetes. I guess our management and investigations has grown better over the years. You see the proportion of unknown cause of end stage is actually getting lower and lower. So that's something good. But you also see a steady rise in the proportion of hypertension causing end stage kidney disease. So that is something that probably we have aware. So diabetes and hypertension takes up the major chunk of cause for end-stage kidney disease in Malaysia. But we have to bear in mind that these causes are usually not biopsy proven. So means we are, a lot of times we based on the clinical cause and also the progression of the kidney function, we are assuming that the cause of the renal failure is due to diabetes or hypertension. Very little amount proportion of these patients are actually biopsy proven, right? So the answer is diabetes mellitus, and the second most common cause is hypertension. For the question is dialysis toxicity. Of course, we have a lot of complication for long-term dialysis, and this is just a few of them. These are the more important complications. So this is a US paper. Just want to illustrate some of the complications of long-term dialysis. So this is a paper in 2008. So you have anemia that will lead to cardiac ischemia and left ventricular hypertrophy and lead to heart failure. And you have all the metabolic disorders, osteodystrophy. Nowadays, the term is actually phased out. We use CKD, mineral bone disease, as a broader term to enclose all the different spectrums of bone disease in the renal dialysis patients. So you also have things like electrolyte problems, hyperlipidemia, and chronic. And we believe dialysis is a chronic inflammation process, and all these things can lead to coronary artery disease and also heart failure. Why do I say the answer, the dialysis toxicity is highly unlikely, is because if you understand the concept of dialysis, is actually using diffusion. So there's a semi-permeable membrane in your dialysate, and this is the artificial kidney that that the dialysis is using. And you notice that your blood flows out, the dirty blood flows out, goes to the dialyzer, get clean the patient, but the dialysate actually flows a counter current pathway. So there's no mixing of dialysate with the blood, and there's only crossing of solutes across that semi-permeable membrane. So in theory, there is actually no dialysate going into the patient's blood, and in that case, patients should not get dialysate toxicity because it's separated by the semi-permeable membrane that only allows crossing of your solutes and electrolytes. And this one, I think is, if you read it, you will know. If you don't read it, I think you just try to just guess, make an educational guess, and you probably get an answer. So that's why I make the answer as quite easy, so that everybody will get the correct one. And I think most of the participants got the correct answer. So to illustrate this, I'll show you the data. This is again from the 2000. So you can see new dialysis patient total is around 8,000 plus. So that's correct. And if you take, this is new one, so it's a bit difficult to see, but you look at new transplant patients, Over the years, you can see the dialysis patients is rising progressively, 4,000, 5,000, 6,000, 9,000, 8,000. I think now it's probably past 9,000 already, but we don't have the official data yet. This is the latest we have, 2018. But you can see the new transplant patient remains static over the years. Actually, a little bit of dropping trend. It was 100 something, 120, 140. Now is dropping to less than 100. So that's actually quite worrying, right? Then you look at the other. This is a total dialysis patient. That the chart I show you is initially is the first one is actually the new dialysis patient on that year, but this is a total dialysis. So we have almost more than 40,000 patients at the dialysing at the end of 2018. And out of that, almost 39,000 is HD patient and only 4,000 is PD patient. So if you look at the percentage, PD is around 10% and HD takes up about almost 90% and transplant is about 4%. So again, going back to the summary, so we have 8,000 new patients needing dialysis every year. So that's correct. We got 8,400 in 2018. Then there's more than 40,000 patients. That's also correct. And 100 patients who receive new kidney anyway, that's also correct. So this one is the opposite. Actually, we have 10 dialysis patients. Actually, 9 are on HD and only 1 is on PD. So that is about it, I think. Yeah, thank you.
Okay, all right. Thank you very much for the detailed explanation, Dr. Albert. Okay, so we'll go on to Dr. Maisarah for the questions related to transplant. The floor is yours.
Okay, hi. Let me share my slide. Can you guys all see my slides?
Yes.
Okay, thank you. Thank you, Dr. Hafiz, for very nice quiz today, Kahoot quiz. I think all of you enjoy it. So from me, basically the first question is, what is the most common type of donor for kidney transplant in Malaysia? I think most of you answer is correctly, about 22. Others answer deceased donor after cardiac death, as well as I think some answer living unrelated transplant. So the most common type, Dr. Albert has shown you the statistic just now. In Malaysia, the main source of donor from kidney transplantation is still a living related kidney transplantations. It can be either you are family members or you are emotionally related, which is your husband or your wife. So of course, we do have deceased donation kidney transplantations, but it's the donor is after diagnosed with a brain death rather than cardiac death. The new terminology now is circulatory death. We don't have it yet in place because technically it's challenging, but that's another options for us to pick up in the future, hopefully to increase number of kidney transplant in Malaysia. Because if you see the statistics, the country like in Europe, Australia, one of the ways that they pick up in terms of the transplant rate by having a donation after cardiac death or circulatory death. So my next question is, in Malaysia, this person can donate without having the approval from the UTAC, or we call it unrelated transplant approval committee, or is our government that need to approve it? So let me see. So I think majority answer is correct as well, about 27 of you. 2 answer friends. Okay, unfortunately, friends or altruistic donor, we still need to go through the unrelated transplant approval committee to get approval, so that we know that these patients kind of the willing donor want to donate the kidney without any pressure, without any other interest before donations. So the only person in this answer is your spouse or husband or wife can donate it, or we call it emotionally related, without need to seek for any approval. So as you can see, this is based on our Living Organ Donation Transplant Unit Medical Development Division, Ministry of Health. So who, in our perspective, close blood relative, which is identical twin and second degree relative or legal spouse, can donate it without any approval. First degree meaning that your mother, your father, your daughter, your son. Second degree as I listed. These are the group of patients that do not need to request any approval prior to donation, and the hospital can decide it. While on the other group, which is not genetically related or distant relative, third degree relative or beyond, this group of patients, if they are willing to donate, need to have approval. I think in Malaysia, we only have done so far one, which is from our hospital, which is a big success. We managed to get approval for altruistic donations, I think about 1 year ago. So next questions, what is the leading cause of death in elderly post-transplant period for recipient? I think Dr. Albert has nicely illustrated that transplant is the best modality for renal replacement therapy, and this associated with increased rate of survival. From your answer, I think 5 answer cardiovascular event, the rest got it. I think most of you answered transplant rejections. Dr. Hafiz has mentioned just now, transplant rejection, yes, rejections can happen. However, usually it's not leading to death. And you need to remember that our cohort of patients, some of these patients has been on chronic hemodialysis or peritoneal dialysis for a long period of time. By doing or remain or peritoneal or hemodialysis, the rate of survival is much lower, as been illustrated earlier. And actually, majority of these patients' cause of death is because of cardiovascular event. So we need to remember this group of patients of plan for transplant, they has been having a lot of risk factor to develop heart attack or heart problem. Okay, so that's the reason why you can see that a majority of our patients seen cardiologists for further treatment. They have a bypass, they have a stent inserted. The reason why, because one, because of your traditional risk factor. Second is because the kidney itself can cause worsen of kidney function because of the inflammation surrounding it. So this paper from Jason published in 2020, as you can see, this is from huge transplant registry data and data. They recruit a patient from 1980 to 2018. So it's about 23,000 patients and 4,700 deaths with a functioning graft. Some, of course, graft failure. Functioning graft meaning that during they pass away or the mortality happened, the kidney function is still good, but because of other reason, the patients pass away. So this is very interesting because of this is a long-term data entry. As you can see, what I would like to highlight here, this is years, which is which era. So you can see in the era of 2015, perhaps 2010 and beyond, the risk of mortality is much lesser, especially first few months after transplantations. It's less in regards to the cardiovascular, cancer death, infection related. Perhaps with the improvement of monitoring, with the improvement of risk stratification before transplantation. So you can see in fact, 10 years after the transplant, in the latest era, the mortality rate become much lesser. However, in the first 3 months post-transplantations, blue representing cardiovascular death, you can see that in the earlier those days, cardiovascular death is the main cause or the main reason that patients pass away. And the risk is still similar, even though the risk of mortality is lower, but it's still the main cause of death, especially first 3 months post-transplantation. This is the one that I have mentioned just now, because these patients at a risk of cardiovascular mortality. If transplantation, hopefully this risk become lesser because you have improved one component of it, the CKD part of it. Patient had a new kidney is functioning, hopefully less inflammation, thus reduce the risk of cardiovascular death. In contrast, if this patient remain on dialysis, the risk become higher. That's the reason why the survival benefits become lesser. Yeah. So my next question is that which of the following transplant medication need to be stopped in anticipation of pregnancy? Okay, this is like Dr. Hafiz said, this is a little bit of knowledge question, whether you know or you don't know. So cyclosporine and tacrolimus belong to the same group, which is calcineurin inhibitor. Another medication is prednisolone. I think from here, 3 of you answer prednisolone. Prednisolone is rather safe in pregnancy. the teratogenic medication in pregnancy that need to be stopped prior to the pregnancy is mycophenolate methylphenidate because the risk of teratogenic effect to the baby. So I will not elaborate this further. I'm going on to my last questions. Ali's brothers wants to donate kidney. What are the relevant long-term complications for the donor? Okay, so the answer is slight risk of hypertension and also slight risk of renal failure. Okay, why is it so? The main source of kidney donation in Malaysia is still living related. With this data, I hope I can convince you all the risk is very minimal. And in fact, prior to the donations, the donor will undergo very extensive workup to be sure that your health is not a problem and you have very good kidney function. You don't have any proteinuria that will lead to kidney failure in the future. So the criteria to be a donor definitely is very strict. From this data, what I would like to highlight is that in the United States, they have about 96,000 kidney donors from the year of 1994. This is from JAMA, published in 2014. So this donor recruited from 1994 to 2011 versus the healthy cohort or the control group from the nutritional examination survey 3. You can see here, yes, live donor and non-donor. Live donor is at risk of developing end stage in the future, but you can see the risk is 30.8 over 10,000, which is about 0.3% after 15 years, versus if you are not a donor, you are also at risk to develop kidney failure, and the risk is about 0.03%. But bear in mind that this comparison, if with a very healthy non-donor, of which that the donor has their health checked, the donor has no hypertension, no blood pressure, as very well donor. If you compare with unscreened non-donor, they are not a kidney donor, but they don't have any medical checkup throughout the years. They don't have any, nobody knows whether this patient has hypertension. This is like normal scenario in our country, okay? When you compare with live donor and healthy non-donor, the risk of developing end stage is much higher in unscreened non-donor versus live donor, and of course slightly risk of end stage in the live donor compared to healthy non-donor. Okay, you need to remember, when the patient donated the kidney to us, of course we will follow up the kidney donor like other patients, monitor their metabolic complications, their diabetes, their dyslipidemia, their hypertension, similarly like other patients, but it's not that frequent. It's at least yearly follow-up. So this group of patients being taken care of as compared to this unscreened non-donor, and their risk of developing end-stage kidney disease is much higher. So one of the criteria before donation is their kidney function. If you are you have very poor residual kidney function, of course you are not eligible to be a donor. Like I've mentioned earlier, it's very strict criteria to reduce the risk of kidney failure in the future, and you can see just now the risk is much lower. So as you can see here, if you are much younger, we require a better kidney function from you. But of course, if in older group, we know that this is like a normal kidney function for elderly population. This is based on the British Transplant Society guideline for a living donations. And you can see that if you are 80 years old, to have a 70 mils per minute GFR is pretty good. And in fact, the range can be in between 45 to 95. As you can see here, the standard deviation. You can see that, of course, you are younger, we require a better kidney function because we anticipate you kind of need to live longer. We don't want you to have any kidney problem, things like that. It's not that to say that if you are older, you can has a worse kidney function and we can take your kidney. No, it's not that. But we know that in elderly, the kidney also aging, so the requirement of GFR is not as high as the younger populations. Yeah. So another things that will kind of a little bit slight increase post-transplantation is the risk of hypertension. This is a well-known of because you take out one of the kidney, so you are at risk of hypertension. So This study demonstrated that living among the living kidney donors and this is a healthy non-donors, kidney donor associated with 19% or 1.19 hazard ratio increased risk of hypertension. However, this risk of hypertension did not translated into worsening of kidney function. So it's not necessary we will call them to have hypertension post-transplantation. If pre-transplantation, their blood pressure is about 120 millimeter mercury, for instance. Okay, post-transplantation, sometimes the BP went up about 5 millimeter mercury, and their blood pressure after the transplant is 1 to 5 millimeter mercury. So they are not hypertension as yet. So there is risk of increase of blood pressure, but it's not translated to worsening of kidney function. That's very important. So in order to promote a kidney transplantation, and in fact, we have collaborate this a short kind of advertisement from me, Hafiz, sambutan Hari Buah Pinggan Sedunia Peringkat Kebangsaan. We anticipate with NKF basically to have these activities at Pasar Siti Khadijah on the 12th of March, but most of the event will be online. If you can go to the Facebook Live NKF National Kidney Foundations and join the program, will be great. Our Ministry of Health will officiate this event, and in the local setting we will have this jump rope challenge, and of course we want as many as pledges in order to increase our deceased donor transplant rate in the future. With that, thank you. That's all from me, Hafiz.
Okay, thank you very much, Mai. So the jump rope challenge is like 2 minutes without stopping, or you have to, like, you know, gaya-gaya sekali ke?
No, 2 minutes without stopping. Who has jumped more, then we get the prize. It is a very nice prize for the NKF. In fact, you can win the bicycle.
Oh, okay. So that's happening this weekend, yeah?
Yes, this weekend, Saturday.
Pasar Siti Khadijah. Okay. All right. Okay. Thank you very much, Dr. Maisarah. So thank you very much to all the panelists, and thank you for all the participants. So I'm still waiting for FA to contact me, and of course the prize goes to the 4th place, which is NK. And please contact me as well. You have my phone number just now. And then for the first one, we realized that both Fang and AR are both from RUCA. So congratulations to RUCA. They seem to have a well ground knowledge for almost every specialty, and that's very good. So congratulations. For the first 2 winners are both from RUCA. So with that, I think that will be the end for today's breakfast at UMHealth. Again, I would like to thank the faculty, the participants, the panelists, and all the participants for the quiz. And hopefully next year we'll have another session like this for the World Kidney Day 2023. In the meantime, thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Bye.